welcome to the education/psychology group. We're going to talk about different learning disabilities that can occur in a classroom and discuss how we can make the classroom a more universal area for those students. So let's start with you. Can you tell us your name?
I'm Wesley, and I'm going to discuss the topic of ADHD.
I'm Lauren. I'm going to be discussing dyslexia.
I'm Anna. I'm going to be discussing depression.
I'm Amber, and I'm going to be discussing the autism spectrum disorder. So here we have a couple questions that we're just going to ask, and we're going to play popcorn and just answer them. So what is everyone's disorder?
I have dyslexia.
I have ADHD.
I have depression.
All right, can we further explain that on like what it is, the definition, symptoms?
Okay. ADHD stands for Attention Deficit Hyperactive Disorder. It involves students who can't stay focused and who can't sit still.
I have dyslexia. It's a neurological disorder that affects one's language skills.
I have depression, and there's two different types of depression. There's clinical depression and situational depression. Clinical actually works with actual chemicals in your brain, where a situation is just like immense sadness from like something that's like occurred in your life.
All right, autism spectrum disorder is obviously a spectrum. It's not a disorder itself. So it's happening with motor skills, social skills, and things like that. So the next question, how is your disorder treated within the classroom?
Within the classroom, ADHD can be treated with teaching the kids better organization skills as well as better communication. If they can communicate, they can tell the teacher they can't sit still, they can't focus, and then there are techniques that students can use to aid them in their learning. So they could tie a rubber band around their chair and they can shake their feet without disrupting other students in the class and without shaking other desks.
Smart.
For dyslexia, one thing that really helps kids is having a quiet area to read. Reading is oftentimes very hard for them, also depending on their age. Younger kids oftentimes are more likely to switch around letters. It's not as common within adults and older teenagers. So one thing that is really helpful and beneficial for little kids is to just have a quiet area where they can focus solely on reading.
For depression, the most common way to help deal with it is to actually meet with just like a regular school counselor and just to have someone to talk about and to like vent your problems and just to have that social interaction, and it really just helps that student to relax.
Okay, awesome. So about autism spectrum disorder, there's a lot of things that children can be enrolled into, different classrooms, things like that. Also working with teachers and all other staff to make the classroom a more easier place for that child. So is there any programs to help your disorder? Like in autism, there's like IEPs, things like that.
Alright, with ADHD, there aren't any programs that the students can seek, but they could go to a we can't use this.
Yes, we can.
Okay, a psychologist where they can be prescribed medications and that help them cope with the disability, as well as they can just talk about it, learning different techniques, how they can stay focused, and different things that they can do that help them.
Is there medication for all your guys' disorders, or is it just solely his? That helps.
There's no medication for dyslexia.
There are medications for depression.
Interesting. So please continue.
So for dyslexia, the treatment is based on rewiring the brain. So what is wrong with dyslexia in the mind is that your brain is not wired correctly for language skills. So the main thing of treatment is just trying to rewire those pathways so you can better understand language.
Interesting.
There are medications for depression, just mostly for clinical depression, because it does deal with the chemicals in your brain, and there are like the lack of chemicals that help cause that depression. So some medications are like a supplement of those chemicals in your brain to help like rewire and make you happier.
Awesome. So what ages or what age of schooling does your disorder can be early diagnosed?
With ADHD, diagnoses typically occur in elementary school, sometimes in middle school.
And now, is there like a girl-boy ratio? Like autism, morally it is boys who have autism than girls. So it's morally just an overall
Yeah, I believe
boy-girl generation.
it's just an overall thing.
Gotcha.
For dyslexia, oftentimes as soon as a kid can start reading is when it can be diagnosable, and the earlier you can diagnose and treat them, the better chances you have of rewiring their brain so they don't have to deal with dyslexia as much the older they get.
It's really hard to diagnose depression with kids because, especially as they're like going into puberty, like they like always feel depressed. But
The awkward teenage phase.
yeah, exactly.
Emo.
But it actually has been reported in a study in 2006 that 45% of women and 36% of men in college felt depressed, that it was difficult to function like in that classroom setting. So if I were to give like an age estimate, I would say like mid-teens.
Mid-teens, the adolescents.
Yeah.
Okay, so is there anything that needs to be done in the classrooms that you would suggest? Maybe like the rubber band thing, you know, just little gimmicks or tricks that really need to be enforced within the education system.
Well, for dyslexia, one thing that's very common with kids is just misspelling common words. So words we use every day that just is kind of second nature for us, they misspell them quite a bit. So one thing that can be really helpful for them is having a word bank on their desk or on their work papers that just gives them a little bank of how to spell common words.
Smart. I think it's really important for us to integrate these kids with these disorders into the classroom, because I feel like if we segregate them in the classrooms, they're going to be segregated for life. They'll always be, you know, put aside or, you know, smack that label on them, and they'll always like grow up with that.
Yeah, it'll move from like being segregated in class to being segregated at work to being
Exactly.
segregated.
And then you'll always have that label, oh, you have dyslexia, oh, you're autistic, oh, you're depressed, and you're automatically put in a category.
But it's also something they take on themselves. They think, okay, well, obviously there's something different with me, so I can't interact with these other people.
Right.
Even though sometimes when you do interact with them, you don't know.
Exactly. Especially in like autism, it's like there's such a, you know, like every disorder has a spectrum. You know, it's like you can have mild or it can be high functioning, you know, things like that, which is very interesting.
Mm-hmm.
So do you guys have a last statement you would like to say about your disorder?
For dyslexia, I would say if you're a parent who has a dyslexic child, talk to the teacher. See how comfortable they are with dyslexia. Do they have experience with dyslexia? Because that'll make a big difference in how they treat the dyslexic kid. If they're not comfortable with it, they might not do anything special to help the kid out, and the kid might struggle more than they need to.
Right, so communication. We can all agree that communication with teachers, psychologists, things like that is very important. That is very important in the school system.
It is.
All right, well, thank you guys. Thank you for watching, guys. Appreciate it. Have a great day. We're out.
Have a great winter break.